As we continue to learn about the novel SARS-CoV-2 virus, it is so crucial that we as citizens evolve with the new data that's coming out. It's totally normal and okay to have questions and to feel confused during this time. We are all navigating a new way of life during this pandemic. Today on City Chat, Ohio Health's infectious disease physician, Dr. Joe Gastaldo, is here to answer the questions we need answers on. Dr. Gastaldo, thank you so much for joining us on City Chat today.
I'm happy to be here, Josie. Nice to see you.
You want to just go ahead and talk about the experience that you have at Ohio Health?
Yeah, so as everybody knows, COVID-19 is a new disease. We are still learning a lot about it, but it's been very challenging for healthcare providers. The way we learn to take care of patients with diseases is we learn about the disease first. There's a lot published on it. We feel comfortable with the medicines. They've been well studied. And when COVID-19 came on the scene, it was a brand new disease that we really didn't know a lot about. We didn't have treatments for it. We thought we knew a little bit about it based on other coronaviruses that have been around for a while. But one of the most challenging things for this, it really is a new disease. It's a new virus that we really didn't know anything about. Today, we are in a much better place, meaning that we know more about it. We're more comfortable treating patients. We have some treatments available, and we're still learning a lot more.
Yeah, it's that kind of dovetails into my next question for you. We all kind of saw what happened in New York when the virus did first emerge, and then 4 months later we get new hotspots in like California, Arizona, Florida, Texas. And then that was despite all of the lockdowns. What do you make of this rise in cases? And do you think that states reopened too soon? And did we as citizens let our guards down?
I think it's multifactorial and probably a little bit of all the above. If we go back in time to the months of March and April, we were in lockdown. Everybody was in lockdown. The businesses were closed. Nursing homes had no visitors. Hospitals in Columbus, including Ohio Health, had no visitors. And we were in complete lockdown. As businesses began to open differently in different states, different geographical areas, when businesses were allowed to open and people are allowed to intermingle, and given the fact that you can have COVID-19 with no symptoms and it's easily transmittable, that was the recipe for it to come back. And what we know now in Ohio is, if you look at the people getting COVID-19, the months of June and so far the months of July, guess what? It's the younger people, the 20 to 40-year-olds are getting it. We're still protecting the vulnerable people, the nursing homes, but when you look at those that are out wanting to live life, wanting to socialize, wanting to do their thing, and get back to some sense of normalcy, there's a 20 to 40-year-olds. And that's no surprise that as businesses opening back up and we began expanding our bubble of socialization, that guess what? We're going to have COVID-19 be spread.
And you know how you mentioned how it's, the median age for COVID, people getting infected, has dropped significantly from the older population. How does that affect the hospitals? Does that change anything in your hospital situations and other acute care settings?
Actually, it does. So in the United States, we do recognize that obesity is a risk factor for being admitted to the hospital and having a bad outcome. And yes, it's true that young people who get COVID-19 are more likely not to require hospitalizations, but I can tell you there are younger people in the hospital with COVID-19, and some of those young people who have health conditions especially, and even some who don't have any health conditions, can get sick from COVID-19. The people who are younger who have COVID-19 with minimal symptoms or who do not require hospitalizations, those are the ones that can act as vectors or spread it to the vulnerable people. I'm not talking about people in nursing homes. Those people are well sequestered. Nursing homes have a lot of stringent policies in place to protect them. I'm talking about elderly who live in their home, your grandparents, my grandparents, and a lot of communities and a lot of households, grandparents and elderly live in the same households with younger people. So I'm worried about vulnerable people getting exposed and contracting COVID-19 from the 20 to 40-year-old crowd.
Yeah, yeah. So, how would you summarize Ohio's journey from the beginning of March until now? And, as some of the counties are being identified as level three, and same with Franklin County, does this concern you? And what are the ways that that can be mitigated?
It does. Last Thursday, Governor DeWine gave a really good discussion on Ohio's journey with the COVID-19 pandemic. I appreciate his recognition of all the hard work that's gone into place. I appreciate his recognition of all the sacrifice that we have made. COVID-19 affects everybody's personal life. It affects their work life. It affects things that give them joy and pleasure. It affects their family and affects all of our loved ones. He acknowledged all of that. Governor DeWine also, too, justifiably so, wanted to bring to everybody's attention that since July, our positivity rate has gone up, and we still continue to be on a trajectory where our positivity rate in Ohio is higher than what it was earlier on in the pandemic when we first. Very concerning, and that really should be a wake-up call to all Ohioans and all people in Central Ohio to practice all of the things that we're supposed to be doing to help flatten the curve. Things like mask wearing in all situations, social distancing, and by the way, being socially distanced is not a reason to not wear a mask. Washing your hands when you're out in public on a regular basis and not touching your eye, your nose, or your mouth to deny the virus to have access to the receptors in your mucous membranes.
Okay, wow, thank you for that insight. This when we talk more about masking, the director of CDC, Dr. Redfield, he issued a statement saying that we could control this pandemic over the next 4 to 8 weeks if there was universal masking. And we just heard from Governor DeWine today that there's an Ohio statewide masking. What are your thoughts? Before he made that statement, and what are your thoughts on masking in general?
Well, first of all, I'm very supportive of the governor's stance of a statewide masking mandate. It is an act of kindness to wear a mask, and I'm hopeful that as human beings, as Ohioans, and as a society of a family that we're all in together, that we want to be kind, and we shouldn't have to tell people to be kind. Wearing a mask is an act of kindness and consideration. The science behind wearing the mask is really clear. Wearing a mask offers two forms of protection. As I said earlier, a challenging thing with COVID-19 is people who are having asymptomatic infection. This infection is predominantly spread through droplets. When you cough, when you sneeze, when you talk loudly, when you sing, during normal conversation, droplets can be spread, and wearing a cotton mask has a major impact on really preventing droplets from being spread. In addition, wearing a cotton mask or a cloth covering of your face in public does offer some protection to the wearer, although the bigger benefit is wearing a mask and preventing asymptomatic transmission in a patient. So that is one tool we have in the box. It is probably one of the more important tools. Keep in mind too, the other things that we have in the toolbox are social distancing and not touching your eyes, your nose, or your mouth in the circumstance where you could touch something that still has an infectious virus on it. That is a minor way that the COVID-19 is spread from person or from touching something. Here is my iPhone that I have right here. If there is infectious virus on my phone and I touch it, I'm not going to get COVID-19 unless I touch my eyes, my nose, or my mouth. That's why when you're out in public, it's very important to sanitize your hands on a regular basis, especially if you're in a public place where there's a lot of commonly placed items that are commonly being touched, like doorknobs, ATM machines, things like that. Again, when you're out in public, sanitize your hands on a regular basis and don't touch your eyes, your nose, or your mouth.
Okay. Yeah, and I was I heard that there was an article that talked about how the virus wasn't so much on surfaces. I mean, are we still going to just choose to practice the safest thing possible, or it is still possible to catch the virus from a surface?
It is, it's not zero risk,
Right.
but it is very low risk. The predominant way COVID-19 is spread is through droplets.
That's right.
When somebody coughs, sneezes, or talks, and those droplets come in contact with your mucous membranes. Theoretically, you could have droplets go onto a doorknob. You touch the doorknob and you touch your eyes, your nose, or your mouth, and the virus gains access to the receptor in your mucous membranes. That is not the predominant way this virus is spread. It is predominantly spread through droplets.
Okay. All right. Thank you. So, what has changed in the realm of therapies for COVID-19?
Yeah, that's a great question. And that's a question I'm actually happy to talk about. In the hospital setting, taking care of COVID-19 is less of a foreign, uncomfortable entity. We have much more experience taking care of patients in the hospital. We have data on prone positioning, which is a certain way of laying in a bed where you lay on your belly to allow the lungs to breathe better. We provide better supportive care. In the treatment realm, there are now two treatments available with medications that are endorsed by national practice guidelines. The two treatments include a very inexpensive medication called dexamethasone or Decadron. Decadron is an anti-inflammatory medication or corticosteroid that's been around for many years. We've used it for years for so many things. And on a randomized controlled trial that was done in Great Britain called the Recovery Trial, in an unyet peer-reviewed or published study, they did a randomized controlled trial showing that the use of Decadron on hospitalized patients decreases mortality of up to a third for people who are maintained on breathing machines, and it also decreases mortality in all people who receive any form of supplemental oxygen. That is a huge thing. It's a cheap, affordable medication. It's a low dose medication. And in situations like that, the potential benefits far outweigh any risk. The second medication we have available is something we've heard about in the news a lot, and that medication is remdesivir. Remdesivir is an IV medication. It's given once a day, and there is publications out there that show that remdesivir scientifically reduces COVID-19 symptoms by a few days when patients are in the hospital. There are criteria to receive those medications. Remdesivir specifically, all it does is inhibit viral replication. It's not a cure for COVID-19, but it has its biggest bang for the buck when you use it earlier on in the disease process, and really it's thought to really be of very little benefit in someone who's had symptoms for more than 10 days.
Okay, yeah, well, that's kind of encouraging. That's kind of good news, that it's treatable.
Yeah, there's other things in the pipeline too, as far as treatment goes. When people recovered from COVID-19, they produce a family of antibodies. Some of those antibodies are neutralizing antibodies, and we ask people who have recovered from COVID-19 to consider donating plasma. When you donate plasma, you can give protective antibodies to people who are in the hospital very ill with COVID-19. There are drug companies that are now doing in research producing these antibodies for neutralization when people have COVID-19. These antibodies will likely be available before the end of the year. The other thing that's also very exciting in the therapeutics realm, and I do want to offer this because it is a ray of hope and something that inspires me to continue doing what I'm doing, and that's for a vaccine. There are over 20 different vaccines that are being researched worldwide. And statistically, I think some of those vaccines will provide great benefit and save lives. I'm cautiously optimistic that there will be a vaccine available either by the end of this year or the first quarter of calendar year 2021. However, when a vaccine comes out, we still obviously have to be concerned with safety. We're not really going to know how long a vaccine gives you immunity for. It could be that when you get a vaccine, you have to get a booster every year, every few years. We just don't know. But we need to get a vaccine out. When a vaccine first comes out, too, then we're going to have to figure out as a country, if we have a vaccine, how many doses do we have? How do we prioritize who gets the doses? Do we have more than one vaccine available? What's that look like? And of course, what are patients' acceptance of the vaccine going to be? Vaccines save lives. I'm here to say that as a scientist. I'm here to say that as an infectious disease doctor. Influenza vaccines save lives. Vaccines save lives, and we want to really promote people getting the COVID-19 vaccine when it becomes available, especially in those most vulnerable.
Yeah, definitely. I heard you talk a little bit about immunity. Do we have a better understanding of immunity yet? And what about herd immunity?
Yeah, so yes and no. We believe, and I do believe clinically, that when people recover from COVID-19, they do develop an immune response. Remember, there's two parts of the immune system. People are always talking about antibodies. That's only one part of the immune system. The other part of the immune system, your T cell mediated immunity, is more complex to really describe. It is not a simple blood test that you could do to measure your T cell immunity. So when most people get COVID-19, they develop an immune response. Most patients will develop an antibody, a family of antibodies, and some of those antibodies are neutralizing and do induce immunity. What we really don't know, however, is how long those antibodies last. Do they last 6 months? Do they last a year? We don't know. And just because the antibodies aren't detectable still does not mean you don't have immunity from COVID-19. The immune system is very complicated, and there's more to it than just measuring an antibody.
So this is my last question for you. As we head into the fall for potential reopenings of schools and, our traditional viruses that come up like influenza, what would be your message for people here in Columbus?
Well, first of all, at the fall, that's a great question. The first thing I'll say is please wear a mask, socially distance, do all of the things that as responsible and caring people we should be doing. We have COVID-19 and we're going to have influenza and other respiratory viruses. Doing all of those things will not only help protect you from COVID-19, but will also help protect you from all of those other respiratory viruses. In cooler weather and cold weather, that is friendlier for the virus. The environment of high temperatures and high humidity is less friendly to the virus. When we start staying inside more because of the cooler temperatures, that's a riskier environment to contract COVID-19 and other respiratory viruses. So we need people to have all hands on deck. And another thing, we really need everybody to get the flu shot or the influenza vaccination. The influenza vaccination is officially FDA approved for all people 6 months and older. We especially want to give it to people with weakened immune systems, the elderly, and pregnant women. I do want to recognize that the flu shot is not produce an immune response in all people, especially elderly people or people with weakened immune systems. That's not a reason you shouldn't get the flu shot. It does work in a significant amount of people. But if you're a younger, healthier person and you get a flu shot and it protects you from getting the flu, guess what? You're going to be less likely to transmit it to somebody who is vulnerable. So in the fall, we really need to have all hands on deck with all of the things I mentioned, in addition to getting a flu shot. And if you are of the appropriate age, to get the shot for bacterial pneumonia.
Dr. Gastaldo, thank you so much for coming on today and just giving us all of this insightful information.
Josie, thanks for having me, and I'm happy to come back again per your discretion.
Thank you so much.
I'm Josie Smith. Thanks for watching City Chat on CTV.